Hello, I'm Dr. Jane, a urologist, and today I'd like to engage in a serious and straightforward discussion with you. If you're a man above 60 and you've observed that your moments of climax seem altered, where you feel the sensation of pleasure yet without the presence of seminal fluid, this message is crucial. Perhaps it occurred just once and left you anxious. Or maybe it's a recurring problem you've stayed silent about because of shame or fear. I want you to realize that I comprehend your worry. What is occurring in your body isn't an indication that your masculinity faces danger, but instead, a vital message that requires decoding. Remain with me, as, in the coming few minutes, we'll examine the causes, warning signs, and above all, the solutions that modern medicine provides to bring back your peace of mind and well-being. Before we delve into the absence of seminal fluid, it's beneficial to quickly review how the process operates under typical conditions. Envision your body as a precisely coordinated system. The testicles generate sperm. The seminal vesicles supply the majority of the nourishing fluid, and the prostate contributes a protective fluid. This combination is assembled in the urethra. During climax, particular muscles contract in a rhythmic manner to push the seminal fluid outward. It's a swift occurrence, stemming from intricate synchronization among nerves, glands, and muscles. It's essential to recognize that climax and ejaculation, although they coincide, represent separate processes. Climax involves the neurological feeling of intense pleasure, whereas ejaculation constitutes the physical expulsion of fluid. Most men perceive them as a single event, yet they function as distinct mechanisms. Our emphasis today lies on what it signifies when the sensation of pleasure arises, but the fluid fails to emerge. This condition goes by the name of dry ejaculation. A man achieves climax, experiences the familiar pleasure, but observes that little to no semen gets released. The lack of this physical element, which has long been viewed as a core aspect of the experience, leads to confusion and unease. Many men in my office describe it to me as an empty orgasm. This view intensifies worry and hesitation to discuss it. It's crucial to grasp that your capacity to experience pleasure, controlled by the brain and nerves, can stay fully intact. The alteration affects the mechanical aspect of the process. This doesn't signify that you've underperformed or forfeited your vitality. It merely indicates that a portion of your body's operation has shifted, and this shift stems from specific causes that we can pinpoint. One of the primary causes of this issue is retrograde ejaculation. Imagine a small valve positioned at the bladder's outlet. In the midst of climax, this valve ought to seal firmly to direct semen forward and outward. Yet, if this valve fails to close adequately, the fluid follows the easiest path and moves backward into the bladder. The man senses the pleasure of orgasm as usual, but because the semen doesn't depart, it seems like a dry climax. A typical indicator to spot this is observing cloudier urine following intimacy, since the semen has blended with it. This can arise from various factors. Procedures on the prostate or bladder, like those addressing benign prostate enlargement, might influence the nerves that manage this valve. Specific drugs prescribed for high blood pressure or certain mental health issues can likewise loosen this muscle, producing the identical outcome. Moreover, neurological disorders, such as prolonged diabetes or spinal cord injuries, can disrupt the nerve signals that orchestrate this closure. I remember a patient who, following a successful prostate surgery, felt profound distress from this alteration. Once he learned it was a mechanical adjustment and that his potency and desire remained unaffected, he experienced tremendous relief. Diagnosis proves straightforward, typically verified through a urine analysis immediately after climax. Although it might influence natural fertility, your intimate life can continue to be fulfilling and satisfying. Another pertinent yet lesser-known cause involves obstruction in the ducts that semen travels through. The seminal vesicles, situated behind the bladder, generate the bulk of the semen's volume. If the ducts leading from these vesicles become blocked, The semen volume might sharply diminish or vanish completely, even when production proceeds normally. Consider it akin to a blocked roadway. Traffic aims to proceed but encounters blockage. Reasons for these obstructions might encompass prior infections, such as untreated prostatitis that resulted in scarring. Tiny stones, resembling those in kidney stones, can likewise develop and impede the pathway. In certain instances, cysts or other structural variations could be responsible. Symptoms might prove understated. Some men mention pelvic discomfort amid climax or realize that their semen has grown thicker and scarcer gradually. Diagnosis frequently calls for imaging examinations, such as a transrectal ultrasound, which enables the doctor to view the seminal vesicles and ducts. The encouraging aspect is that numerous such obstructions can receive treatment, either via medications targeting an infection or through minimally invasive techniques to unblock the duct and reinstate normal flow. The third principal domain to examine is hormonal influences, especially testosterone. This hormone serves as the primary force behind male reproductive operations. It regulates not just desire and sperm generation, but also plays a key role in the effective operation of the prostate and seminal vesicles. When testosterone levels decline markedly, the whole system may suffer. At first, a man might detect merely a drop in semen volume. As time passes, additional indicators could surface: reduced libido, erections that are less rigid, and an orgasm sensation that's diminished in intensity. On a wider scale, fatigue, reduction in muscle mass, and shifts in mood often occur as well. It's an error to attribute this entirely to the aging process. Frequently, it's a medical issue termed hypogonadism, a hormonal shortfall that can and should undergo treatment. Diagnosis occurs via blood tests assessing hormone levels. If a shortfall gets confirmed, hormone replacement therapy can reinstate not only semen production, but also vitality, desire, and general quality of life. Thus far, we've covered causes that, in large measure, offer solutions or strategies for management. Nevertheless, as a physician, it's my duty to caution you that dry ejaculation might also signal more grave conditions. That's precisely why attending to additional symptoms holds such importance. Specific forms of urological cancers can lead to blockage in the ejaculatory ducts. For instance, prostate cancer, during its expansion, can obstruct the semen's route. Bladder cancer, if situated close to the outlet, can similarly disrupt the procedure. In such scenarios, the lack of ejaculation could accompany other indicators, such as blood appearing in the urine or semen, or pain in the pelvic region. Progressive neurological illnesses represent yet another significant cause. Disorders like multiple sclerosis, Parkinson's, or nerve impairment from inadequately managed diabetes can interrupt the signals between the brain and reproductive system, resulting in this and further dysfunctions. Therefore, it's essential to recognize when immediate medical assistance is required. If dry ejaculation emerges abruptly and inexplicably, or if it pairs with pain, blood, fever, or diminished sensation in the genital region, hesitate no longer. These serve as indicators that a more severe matter might be unfolding, and prompt medical assessment becomes imperative. Beyond the bodily dimension, we mustn't overlook the deep emotional toll this condition can impose. Numerous men link ejaculation to their virility and prowess. When it ceases, sensations of inadequacy, anxiety, and irritation may emerge. It's typical for men facing this to begin shunning intimacy due to apprehension of judgment or a sense of incompleteness. This emotional load is genuine and can adversely influence self-worth and partnerships. The foremost action to disrupt this pattern is gaining knowledge and fostering dialogue. Realizing that this constitutes a physiological shift rather than a personal shortcoming alleviates a substantial burden. Your capacity to experience pleasure, achieve erections, and relish intimacy relies not exclusively on the existence of fluid. Your intimate life can, and ought to, persist as a wellspring of delight and bonding. Engaging in candid conversation with your partner and pursuing expert assistance are measures that reclaim authority, enhancing assurance and life quality. To conclude, I wish to offer you some actionable guidance. Primarily, never dismiss alterations in your body. An abrupt start of dry ejaculation justifies consulting a urologist. Next, maintain oversight of ongoing conditions like diabetes and hypertension, since they profoundly affect vascular and nerve vitality. Third, embrace a healthful routine. Consistent physical activity, nutritious eating, and restorative sleep form the foundations of comprehensive health and, by extension, intimate performance. Fourth, end the quietude. Expressing your emotions, be it to your partner or a physician, proves freeing and opens paths to resolutions. Lastly, adhere to expert recommendations, be it via therapy, altering medications, or a modest tweak in habits. Expert aid stands as your premier resource. In essence, the lack of ejaculation doesn't mark the conclusion of your intimate life or affirm diminished masculinity. It acts as a cue from your body that merits attention and scrutiny. Grasping the underlying reason, be it mechanical, obstructive, hormonal, or neurological, marks the initial stride toward attaining serenity. I've witnessed innumerable men reclaim their assurance and pleasure in existence after obtaining a definitive diagnosis and strategy for action. Your vitality gets gauged not by milliliters of fluid, but through your health, well-being, and capacity to embrace life wholly. Allow neither uncertainty nor embarrassment to deter you from pursuing clarity. Timely intervention can reshape your encounters, reinstating the assurance and bonds you merit. If this message held worth for you, kindly share it with a companion, father, or sibling. Such knowledge can create substantial impact. Offer a like to aid in disseminating this message to additional men who require it, and subscribe to the channel while enabling notifications to ensure you catch our forthcoming material on men's health. Bear in mind, prostate health extends beyond mere longevity. It's about thriving fully. Remain knowledgeable, initiative-taking, and most crucially, robust. I'm Dr. Jane, and recall, your finest years might lie just ahead of.